Hey there, everybody. Dr. Patel here. Sorry about the delay. Hope everyone's doing well. I am here today talking about a topic that is near and dear to my heart, and that is what is a DO? So, the reason that I'm bringing this topic up is because there has been a lot of controversy, hoopla, negative press, discrimination, call it what you will, about DOs over the course of the last few weeks. Why is that? Well, we found out a few weeks ago that President Trump went to the hospital because he was infected with COVID, and his physician there at the hospital was a DO. And this is different than an MD, and I'm going to go into what that means in a second. But the second that it was revealed that that Donald Trump's physician was a DO, you can imagine the outrage that went throughout the world and internet, and a lot of people that are anti-Trump started saying that he had a physician that was not a real physician. The media, there was a lot of articles and press things that came out saying that he was being treated by an osteopath. And there's a lot of negativity that surrounded that. But that in itself wasn't that big of a deal. But this last week, there was another crazy thing that happened that really was the icing on the cake that prompted me to do this little Facebook Live today. And that's that a fairly well-known company that makes scrubs for medical professionals put out an advertisement that was quite callous and honestly comically discriminating against both DOs and actually also female physicians as well. It was a little video clip essentially that showed a female physician that had a badge that prominently displayed the letters DO on it, and she was reading a book, Medical Terminology for Dummies, and that book was, of course, upside down. So, pretty ridiculous, and I don't know if they're discriminating and saying that female physicians are dumb, or that DOs are dumb, or that people that wear figs are dumb, but either way, it was really poor marketing on their behalf. And ultimately, that prompted me to say, hey, you know what? I'd like to talk a little bit more about DOs and explain what DOs are. Because the reality is that a lot of people don't even know what DO stands for, or what DOs are in general. So I wanted to really answer that question. So um, please, if you're interested in this, before I get started, please, if you're interested in this, if this vibes with what you're hearing, share it. I'd love to spread information about what DOs are and what we do, what we don't do, who we are, etc. So please share this. I also have a blog article on this topic on my website, and you can get to my website actually two ways now. We're transitioning over. My website is www.stemcelldrpatel.com, but our new website name is fxregencenter.com. That's FXREGEN center.com. So please go there, check out our blog, and you can read a little bit more about what is a DO. So, without further ado, DO stands for Doctor of Osteopathy, or Doctor of Osteopathic Medicine. A DO is one of the two types of physicians in the US. And the most commonly known physician is an MD, or medical doctor. So there are MDs and there are DOs that both provide medical care for people and are both considered physicians. So let me get that straight right off the bat. There are a lot of doctors out there, right? There are doctors of chiropractic, doctors of podiatry, there are doctors of Oriental medicine, and there are doctors of nursing, right? There are doctors of physical therapy. There's a lot of different types of doctors out there, and really all of these doctors have their skill sets, their trainings, and they have the ability to take care of patients in various different ways. When it comes to being a physician, there are two types. There are MDs and there are DOs here in the US. So, what is a doctor of osteopathy? What is osteopathy? Well, osteopathy or osteopathic medicine is actually a relatively young field that started really in 1874, so just over 200 years ago. No, just over 100 years ago. My math isn't really too sharp right now. But basically, this field started by an MD named A.T. Still, who at the time was ultimately fed up with the way that medical doctors treated patients. At that time, things were a heck of a lot more crude than they are now, but regardless, he did not like the idea of reactively doing things like surgery, and he really was starting to realize that the body has the innate ability to heal itself if we can get that body to move and act correctly. So he started experimenting, and he started, looking at the bones of the body and looking at the human body anatomy and physiology, and that's how the field of osteopathy came into existence. But as an MD, he brought in a lot of that MD mentality. By the way, I'm going to use the word MD and allopathic medicine synonymously, because MDs practice are physicians that are doctors of allopathic medicine, and DOs are physicians that are doctors of osteopathic medicine, and that's the delineation between the two. But I'll use these words interchangeably, so forgive me. So A.T. Still, having been trained in allopathic medicine, really integrated the two of those things within his new field of osteopathic medicine. And ultimately, that mixture has been what has pervaded osteopathic medicine since then. Just like allopathic medicine, osteopathic medicine has evolved over the years. And now at this juncture, osteopathic physicians go through similar and virtually really similar training of 4 years of medical school, the same type of medical school classes as MDs. So everything from microbiology to physiology to anatomy to chemistry, all of these things that are involved with allopathic medicine are also taught in osteopathic medical school as well. One of the major differences, however, and there are two major differences between osteopathic medicine and allopathic medicine. One of the major differences between the two is that in addition to the normal clinical medicine and lab-based medicine, fundamental didactic medicine that's learned in medical school, osteopathic physicians also learn what's called osteopathic manipulative treatment or osteopathic manipulative medicine. What is that? So one of the important factors of osteopathic medicine was that A.T. Still started treating patients using his hands. And our hands have become a very important part of our both diagnostic and therapeutic strategy when it comes to addressing patients. What does that mean? Osteopathic manipulative medicine involves laying our hands on patients to really feel and help with that diagnosis, really capitalizing on that physical examination and taking that physical examination to the next level in comparison to allopathic medicine. And the other part of osteopathic manipulative medicine is not only getting our hands on patients and diagnosing, but also using our hands to treat. So a lot of osteopathic manipulative treatments or techniques, or OMT, involves using your hands on as manual therapy with a lot of similarities to chiropractic adjustments, a lot of similarities to physical therapy manual modalities, a lot of similarities to other manual therapies that are available to people. So we do things like soft tissue manipulation of the fascia, manipulation of muscles, as well as more manipulation of joints as well. You may be familiar with chiropractic adjustments that involve a high velocity kind of thrusting maneuver that causes a crack, or in chiropractic is called a cavitation. In osteopathic manipulation, these high velocity, low amplitude maneuvers are a part of the OMT that we can offer to patients. And osteopathic manipulation, logically has a lot of potential benefit for conditions involving the musculoskeletal system. But there's some interesting research out there that talks about osteopathic manipulation for things like helping people with, upper respiratory tract infections, sinus infections. There's a thing called percussion for chest when it comes to things like pneumonia. There's lymphatic drainage that could be, or lymphatic pumping that could be done to drain the lymphatic system, which is our body's way of transporting waste. So there's a lot of different techniques that are available, ranging from the more practical and logical all the way to the more pragmatic and more conceptual. There's a lot of various different treatments that are out there within the field, within the world of osteopathic manipulation. So OMT, or osteopathic manipulative therapies, treatments, osteopathic manipulative medicine, that is one major differentiating factor between DOs and MDs. What is the other major differentiating factor? And that's actually the osteopathic philosophy. This is actually a really important distinguishing characteristic of DOs, is that from day one of our medical school training, we learn what are called the osteopathic tenets. Now, this is a philosophy that there's a lot of MDs out there that really adhere to this philosophy as well, but this is something that's taught to and ingrained in osteopathic physicians from day one. So there are 4 osteopathic tenets that we learn. Number 1 is that the body is a unit. That means that the body is a whole. We can't look at just elbow injuries. We have to look at the elbow as a part of the arm, as a part of the body. We can't just look at sinus infections. We have to look at that as a system. We can't just look at diabetes. You get my drift, right? So the body is a unit. The body is a whole. And the person is not just the body, but also the mind, the spirit. All of this is together, and that is an important component of how we approach patients. So the first tenet, body is a unit. The second tenet is that the body has the inherent capability to self-regulate, to self-heal, and to maintain their own body. So what does that mean? Well, just to put it as a simple sentence, is the body has the ability to heal itself. That's an important statement, because that tells us that if we can optimize our body, then we can actually heal when we have an injury, right? Think of us when we're kids and we bounce back from injuries real quick. As we get older and as we are not moving correctly, as we're sitting in front of our desks, as we're sitting in our cars all day, every day, our body develops patterns that do not allow us to heal appropriately. So the concept is that if we can get the body moving correctly, then the body has the ability to heal itself. The body has the ability to self-regulate. The third tenet is that structure and function are interrelated. It's an important concept too, right? Because the function of our body, the ability for our body to move correctly, ultimately has to do with our structure, the way that our body is built. Really, really important factor to consider. And then the final tenet is ultimately that the true understanding of the body and treatment of the body involves the interrelationship of tenets 1, 2, and 3, right? That the body is a unit, the body is capable of self-healing, and that the body has a connection between structure and function. So the true treatment of somebody, of any individual, involves tenets 1, 2, and 3, and that's what tenet 4 says. So why is this philosophy so groundbreaking, right? Well, this philosophy was groundbreaking when AT Still came up with osteopathy because traditionally allopathic medicine has really always been reactive, right? You have an injury, you break a bone, you fix it, right? You get a cold, you treat it with an antibiotic, right? But it really is treating the symptoms. It's treating the you know the issue, the condition, but it's not treating the underlying cause. And it's certainly not proactive in order to allow the body the best opportunity to heal, to fight infection, to heal from an injury, etc. So this was really groundbreaking that AT Still started to delve into these thought processes and created this philosophy for osteopathy. Now again, this isn't to say that there aren't MDs that treat patients this way. There's a ton of great, really holistic MDs that are out there. And quite frankly, there's a lot of DOs that don't think about this philosophy as a part of their treatment strategies. But the point is that DOs are really taught this from day one, and this is really ingrained within the way, at least the way I practice in my medical practice here. So what are the similarities between MDs and DOs? MDs and DOs both have 4 years of medical school education, including didactic science courses, including clinical experience with various different fields. Furthermore, MDs and DOs both go to postgraduate training. After graduating from medical school, we all go through a residency programs. Some of us may go through internships. Beyond residency, people go through fellowship programs. Those are all similar. And in fact, over the course of the last few years, whereas we previously had separate postgraduate trainings in one way, shape, or form, now these are completely combined. So you have people that are training MDs and DOs together side by side. My experience, for example, I went to Osteopathic Medical School in Chicago. I did my internship as an osteopathic internship, but even in that osteopathic internship for 1 year, I was training side by side with MDs as well. And then my residency program and my fellowship were both allopathic or MD postgraduate training courses that I was side by side with MDs throughout my training. So very similar in those regards. The main difference is, again, number one, osteopathic manipulative medicine, and number two, our osteopathic philosophy and tenets. So I hope that was clear in explaining what the differences between everything were. You know, it's interesting because there's actually always been a stigma against osteopathic physicians for the last century, right? There was actually a time period in the past where there was such animosity and such criticism of DOs that there were schools actually here in California that you could pay an extra fee and you can get your MD letters at the end of your name, and you can completely forego the fact that you were a DO. So there was a lot of people that actually went through that. There's still a stigma against DOs, and even amongst postgraduate trainings. There's a lot of specialties that prefer MDs over DOs, but really without significant merit. On the other hand, there are some specialties that embrace DOs. Primary care is actually one of them, because DOs do take that holistic approach, and DO schools do tend to advocate for physicians to go into primary care practice, and especially in rural settings. So DOs really take that to heart, and there's a big DO contingency within primary care. But another field that really embraces DOs is actually my specialty of physical medicine and rehabilitation. Because as you can imagine, physical medicine and rehabilitation, I'll go through this on another video as well, is it really focuses on non-surgical orthopedics, but also spinal cord injury, brain injury, taking care of patients after surgeries, sports medicine, pain management. All of this is encompassed within physical medicine and rehabilitation. But a big part of physical medicine and rehabilitation, also called physiatry, is the musculoskeletal system. And it makes sense for DOs that have additional training in the musculoskeletal system to be somewhat coveted within the physiatry world. I had a great opportunity to incorporate osteopathy in my residency program, even working with MDs, teaching MDs how to do osteopathic manipulation. It was a fantastic part of my training career. But, finally, the last thing that I want to talk about is my practice now, and how I really incorporate being a DO in my practice. Is that the fact is that the primary tool that I use in my tool belt is regenerative medicine treatments, orthobiologics, using a patient's own body growth factors, stem cells, platelets, etc., to help with the healing process. Sound familiar? Right? Because the osteopathic tenets really parallel with the ideas behind regenerative medicine. In fact, the osteopathic tenets have really paralleled each step of my education and each step of my specialties. The fact that the body as a unit really has pervaded my mentality towards patients throughout. That the body has the capability of self-healing. I mean, that's clearly a premise behind regenerative medicine. The fact that structure and function are interrelated, well, that really comes down to physical medicine and rehabilitation, because PM&R, or physiatry, focuses on improving function, right? So these are really important parts of the way that I treat all my patients. I want to make sure that we are addressing not only the injury that you're coming to me for, but the why. Why did that injury occur? How can we address not only the injury, but all the various factors that are involved and improve your life as a whole? I really credit that ultimately to my education as a DO, and my belief in the philosophies of osteopathy have really shaped me, have really molded me in my practice right now, and I hope that makes sense to you. I hope that you jive with that. Okay. I hope that all made sense. Haven't had lunch yet, so it could have been a little bit of verbal diarrhea there, but hope that was beneficial for you guys. Hope that cleared up the air as far as what is a DO, what's the difference between DOs and MDs, and how does being a DO affect my practice with you. If this made sense to you, if you liked it, if you know people that don't know enough about DOs, please share this. Please spread the word. Let's stop the DO hate, and let's stop the hate overall. This isn't the time for us to be ostracizing people. This isn't the time for us to be dividing people. This is the time for us to all come together, help each other out, and recognize that there are good and bad within all of us, right? There are good and bad DOs, there are good and bad MDs. There are certainly good and bad people in the regenerative medicine space. But I implore you to look at all the details, look at all the facts, gather information, and be an advocate for yourself. The only way to be an advocate for yourself is to know more, to learn more, and to spread the word. So, wishing you guys the best. Feel free to reach out if you have any questions, concerns, comment, DM. You can contact us at info@fxregencenter.com. Our new website is fxregencenter.com. You can still reach us at stemcelldrpatel.com as well for now. Hope you guys have a great Friday and a great weekend. Until next time.